Today, we're announcing an exciting partnership between the Maryland Lottery and the Maryland Department of Health.
It's been nearly 2 weeks since the state started to use the lottery to boost COVID-19 vaccinations. $40,000 a day awarded to a vaccinated person whose name is drawn. In Northwest Baltimore, Marvin Dunn told us he has a different incentive, spending time with his children.
I'm going to be around them, be around them a lot. And then by them not being able to get vaccinated yet, I don't want to mess around and, give it to them.
Marvin and other residents in Baltimore are now finding an easier time getting vaccinated. Small pop-up sites, mobile sites have been added to the larger mass vaccination sites and pharmacies.
I just walked up, got it, waited 15 minutes, and I'm out.
It's been nearly 3 months since the governor formed a vaccine equity task force headed by a commander of the National Guard intended to close the racial gap that had opened in the rate of vaccination. Since the rate of vaccination of black people has increased, but in recent weeks flattened out. Black people make up 31.1% of the state's population. They made up just 14.6% of fully vaccinated people on March 5th. By May 5th, that number had climbed to 21.14%. It's barely inched higher since. Today, the number of fully vaccinated people in Maryland who are black stands at 21.84%.
We know that our populations can be harder to reach. We know that our populations need additional support with access and with transportation.
In Baltimore City, with one of the largest black populations in the state, Health Commissioner Dr. Letitia DeRosa suspects the early rules for vaccine eligibility limited the reach to minority populations.
Some of it is related to who was eligible in the beginning, right? It was focused on healthcare workers, or it was focused on certain professions. So that could have also skewed the data.
The mass vaccination sites have also been harder to access for people dependent on public transportation. Thus, the city's turn to the pop-up sites offered several times per week, concentrated in East and West Baltimore. Hesitancy seems to ease when access improves.
I just wanted to get vaccinated because I ain't want to get it. Long story short, because I got a daughter, I got family, so it's like I can't afford to get COVID.
I just haven't had the time. That's all. But I have to for the job. I just started working. So Monday, I'm going to go get vaccinated.
Surrounding jurisdictions also see an equity gap. In Howard County, black people make up 19.9% of the population, but 7.8% of people fully vaccinated. In Baltimore County, black people make up 30.3% of the population, but 18.6% of county residents fully vaccinated. And in Baltimore City, black people make up 62.7% of the population and 43.6% of people fully vaccinated. The health commissioner warns about what could be ahead if higher vaccination levels aren't reached.
I think that's my big concern, right, is if we're this time in the fall, if we haven't vaccinated enough people, if we're still not able to vaccinate enough children, we could see resurgences in the fall. And we know fall, people move back indoors. It's a lot cooler. So that's definitely a concern. Do we see resurgences of COVID come fall, winter, when people move back indoors if not enough people are vaccinated?
Baltimore Mayor Brandon Scott has set a mark of 65% of adults in Baltimore City to have one dose of the COVID vaccine in order to lift the indoor mask mandate. Right now, that number stands at 55%. In West Baltimore, I'm Jane Miller, WBAL TV 11 News.